Welcome back. We start our top 5 tonight with a new study that's already causing controversy. This is from Harvard researchers. They have found the majority of women who die of breast cancer don't get regular screening mammograms. Joining me now is Dr. Brett Parkinson, the director of Intermountain Medical Center's Breast Care Center. Now, help clear this up, because there's a certain age and there's been misconceptions and mixed messages about what age should you get a mammogram.
Well, this is an important study today because in 2009, the United States Services Preventative Task Force recommended that women no longer have regular screening mammography between the ages of 40 and 49. And of course, that created a lot of confusion because women didn't know what they should do. This was an about-face from what they had recommended in 2003 and didn't really go along with what the American College of Radiology or other major societies recommend.
So this ought to clear up the mixed message because of how many women they found who died under the age of 50.
Right. Dr. Katie and his researchers looked at 7,300 women. 609 of those women died of breast cancer, and 71% of those women who died had not had regular screening mammography. And what's really important to note is that 50% of the women who died were under the age of 50.
Wow. So there's your incentive. 40, does that make it the age then at 40?
Right. And what Dr. Katie did was interesting because he did what we call a failure analysis. So it's like a black box in aviation where they looked at death rates, the 609 women who died, and they analyzed whether or not they'd had a mammogram. They looked at their surgery reports, their pathology reports, and other things surrounding their diagnosis, and then they came up with these results.
So what is the recommendation based on this study you see? Well,
this study is just part of the conversation, but our recommendation continues to be yearly screening mammography from 40 on, for long as a woman is healthy. And what's important to know is that the randomized controlled trials upon which we based our previous recommendations are flawed because there's contamination bias. Women in the screening group were not screened, and some of the women in the non-screened group were screened.
Why was the recommendation to back away in the first place? What's the controversy in this?
Well, I think part of the controversy is that the task force looked at some of the perceived harms of screening mammography, which would be overdiagnosis or unnecessary biopsies. Well, most of the women today for whom we recommend biopsy don't have to have an open surgical biopsy. We're able to do image-guided percutaneous biopsies with a needle. So that harm has actually decreased in the last several years. And we should also remember that the death rate from breast cancer has decreased 2% every year since the 1990s. And much of this has been due to increased screening.
Wow. Well, this is good information for women, knowing that the risk of mammography is lower and the importance of it is more high based on these numbers.
It's very important, and we have new technologies coming out. We have tomosynthesis coming out, which is like CT of the breast, which we're going to start in October. So there are a lot of new things on the horizon. One last thing is that this study done from Harvard corroborates a study that we are presenting at the American Society of Clinical Oncologists in November. We looked at the 40 to 49-year-old age group, and we found that women who were screened had a much less chance of dying than those who were unscreened.
Okay, that does help clear it up. Dr. Brett Parkinson, we appreciate the information and the clarity.
Well, thank you.
Another important story tomorrow.